Right, folks, I think we will kick off. Sorry, Kerry. So welcome everyone to this Health and Adult Social Services Scrutiny panel meeting. The meeting is being held in a hybrid form. So there are some members of the panel in the room and officers, of course, and you're all very welcome. And we've also got some colleagues that have joined us online as well. Just a reminder to everyone that we are live streaming on YouTube this evening. Can I just remind, I think it's just Robert and Maggie online, just to remain muted unless of course you're speaking, and just to use the raise hand icon as well. Apologies for absence. I've got apologies from councillors Raza and Ty. Are there any other apologies? I don't think so. Lovely. Urgent matters is item 2, and there are no urgent matters on the agenda. Item 3 is declarations of interest. I will start us off. I'm employed by the Nursing and Midwifery Council. Councillor Conti.
I'm a GP in North West London.
Any other declarations of interest in the agenda this evening? Item 4, matters to be considered in private. There are no matters to be considered in private. And then we move on to the minutes of the meeting. Councillor Crawford.
Yeah, thank you, Chair. Under item 3, declarations of interest, I declared that I had recently participated in the LGA peer review, and I'd just like to clear up that while I did recently participate in an LGA peer review, it's not the most recent one. It's the one from December 2021, possibly. We can clarify that, but I think it's necessary to state that what it was not the most recent one, basically. Fine. If that's okay. No, sorry. I appreciate maybe this is a confusion. I'm talking about the LGA peer review when I was the chair of the panel, right?
So I think what we'll do, Councillor Crawford, is on that particular point, we'll reflect in the minutes that it was a previous LGA peer review, if you're comfortable with that.
And then I did have a discussion with both of you about how the final element, but we'll pick that up outside of the meeting.
Very happy to.
If that's okay.
No problem at all. Thanks very much. Can I get agreement from panel members on the minutes of the previous meeting, subject to that those amendments?
Great.
Thank you very much. So we then move on to exciting part of the agenda, actually. The appointment of new co-optee panel members. So just a reminder to panel members, you previously requested that carers and service users, and I think it was Councillor Kate Crawford that in particular requested this be represented at panel meetings, and I'm pleased that we have Gule, Hanid and Connor Wood here with us this evening. Gule is the co-chair of the Carers Co-Production Board, and Connor is the co-chair of the Autism Co-Production Board, and both have agreed to join the panel. Should I just pass over, Gule, for you to introduce yourself, and Connor as well, just to say a few words? And you'll just need to use the mic, which is just in front of you. There's a button to press as well. Thanks.
Good evening, everybody. My name is Gule Hanit, and as we hear, I'm the co-chair of the Carers Co-Production Board, and I am a carer of 3 people. One 40-year-old sister who is paralyzed, bedbound for the last 10 years. I'm also a carer of my mom, who's 70 and who had a recent stroke in December and also housebound now, and a carer of my 87-year-old father, who's got long-term living conditions as well and is losing his memory gradually. And I'm working full-time as well. So I've got a lot of experience accumulated over the years. Thank you.
Connor, did you want to introduce yourself too?
Good evening, everyone. My name is Connor Wood. I'm the co-chair of the Autism Partnership Board. I got diagnosed with autism when I was roughly 11 years old. I've used some services here and there as I was growing up. I've been a member of the board since 2021. I've been co-chairing it since 2022. And thank you all for the opportunity to be a part of the panel.
Thanks, Connor and Goulet. I think you'll be fantastic additions to the panel and really bringing to the fore that lived experience. So looking forward to your contributions. I should also say under this item that David Crawley, who's representing Healthwatch Ealing, our suggestion is that David, you become the Healthwatch Ealing co-opted member, replacing Carleen, who you were already deputising ably for at previous meetings. And then the only other thing to add is that Ealing and Hounslow Community and Voluntary Service have been invited to nominate a representative in place of Anthony Brooks. And as soon as we've got an update on that, we will let colleagues know. Can I ask for agreement from the panel?
Absolutely, Chair. Yeah.
Thank you very much. So we will then move on. So item 7 of the agenda is the panel work programme. So we're being asked to consider the draft outline work programme that's in front of you. I'm just going to highlight a few things. Officers are in the process of arranging a visit to the Careline office in Harrow for colleagues that wish to attend, and that will be before the May meeting of the panel. The next meeting of the North West London Joint Health Overview and Scrutiny Committee is this Thursday on the 13th of March. The main item that's on the agenda for that meeting is to consider work that's being done to develop a planned elective care strategy in North West London. So I will be attending that and be able to feed back on any kind of key developments after the meeting. I should also say that in December, I attended the first meeting on the Mount Vernon Cancer Care Centre. That was the Joint Health Overview and Scrutiny Committee that's being hosted in Hertfordshire. That was the introductory meeting, and their next meeting is on the 24th of March. So I will circulate an update following that meeting. Are there any comments on the panel's work programme or any suggestions of items for scrutiny at future meetings? Councillor Crawford.
It's a bit previous of me, but looking at the work, we've only got one more. Is that correct? There's only one more meeting after this. So having been in position itself and the vice chair have been at RN, it may be useful to think about some of these items perhaps going into a future work programme, and I'm sure you've already done that. So yeah, maybe we can, I expect we'll have a look at a possible skeleton work programme for next year in the next meeting, or not? No? Okay.
So the process, so very happy to add future suggested agenda items at the bottom of the sort of the outline work programme. The process will be that we will develop the new work programme when we've got clarity on who the chair of the panel will be moving forward. I think it wouldn't be right to make any assumptions in that space. So we will go through our normal process over the summer of developing the work programme, and the process that we normally follow, just particularly for our new co-op team members, is that we ask for suggestions from officers. We also meet with NHS colleagues as well, and we come up with a programme that we can really focus on throughout the year with a range of pertinent topics, but we always try to also add in some flexibility so that if items do come up throughout the year, we've got that ability to be able to scrutinise them at short notice too. So that's the position. Any other questions or comments on the work programme? Not at this stage, so we're happy to adopt it as it stands. Thank you very much. So we now move to item 8 on the agenda, which is the Ealing Safeguarding Adults Partnership Board Annual Report 23-24. Robert McCulloch-Graham, who's the independent chair of the board, is online, and I'm coming to you first, aren't I, Robert, just to give some sense of the work that's been undertaken by the panel from April 23 to 24, and then we'll open up for questions after that, if that's okay.
Yes, that's fine. Thank you very much, Chair. Thank you very much, first of all, for the invite to come and share some of the work that the Safeguarding Adults Board in Ealing has been undertaking in the previous year. I'll give some explanation as to what we do first, and then move into a bit of a history over that year. And as Councillor Weston says, I'll leave time at the end for some questions so we can maybe explore it. Can I just check that you can all hear me okay?
Yeah, we can hear you loud and clear.
Great.
Thanks.
That's great. Thank you for that. Okay, so there are three main functions of safeguarding adult boards. Our ultimate aim is to reduce the level of risk for vulnerable adults in the areas in which the boards operate. So for Ealing, our aim is that the partners involved in the board and represented on the board work to reduce the level of risk of abuse, risk of neglect, and danger to each and individual vulnerable adult within the borough. So that's our ultimate aim. The functions of the board then are to develop a strategic plan which will have that single aim to actually reduce that level of risk. We then have a second function, which is to report on the business of the board and the partnership, and that's our annual review, and that's what I'm bringing to Scrutiny tonight, is our annual review for 23-24. And the third duty that we have is for to initiate and commission reviews where we have any significant incidents which occur, where we believe there is learning to be had between agencies and across agencies, where incidents have taken place, and where we would actually commission an independent reviewer for the board, and for the board then to commission an action plan for services to undertake. So those are the three functions that the board has to do, our three duties. So the report itself has got several intentions, every annual report. So the first is to be a reference document so that people can dip into this report to see what are the functions of the partnership, what is it we do, and how do we actually do it. So not a lot will change between year to year within that, but it's still there in every report that we do. The second aspect of that is to give you a story of what's happened in 23-24 and to demonstrate what the pressures are on the services, how they've actually operated, and to give an indication into some of the stats behind that, some of the statistics and some of the pressures that we have to do. And then basically it's to give a picture of safeguarding within Ealing. So where are our pressures? What is it we do? And how does that actually manifest itself within Ealing? So the board itself is actually made up of 4 groups. So there's the board itself. Within that, it's supported by an executive group, and that executive group is supported by 2 further subgroups. There's an effectiveness subgroup which looks at the work of the whole of the partnership, and it allows a questioning and a challenge to be undertaken from partners on each of those services, both individually and collectively as well. And we have a further group, which is the SAR subgroup. That's our Safeguarding Adult Reviews subgroup. And that's the group which will decide if incidents meet the criteria for undertaking a Safeguarding Adult Review, and that group will also oversee how that review is undertaken and how it moves into an action plan stage, and where we get into learning for each of the agencies that are represented on the board, so that that learning is encapsulated in improvements in services. So those are the boards that sit underneath it. Collectively, the report shows that we have a funding aspect within there. So 3 statutory partners. We have our health colleagues through the ICB, we have our police colleagues, and we've got the council as the major 3 partners. And we have funding coming from each of those 3 partners in to support the overall work of the board. It has to be said that the council itself actually covers, because there's a current shortfall in the costings, and there's some national work that's going on, or sorry, some work across London to work with our police colleagues, because there is a fairly evident shortfall in the funding that comes from the Met Police, and that's been recognised across all of the councils and all of the partnerships across London, and there's some work undergoing with the Met currently to see whether we can get some redress on that. So if I take you to the actual report itself, and I think to give you a bit of an insight into the safeguarding practice and the safeguarding work that's been done, probably it's best to go into the statistics. I know you've had copies of the report, so if I take you through page 7 onwards, that gives some of the data of what we've been actually dealing with in that particular year, and I'll put some narrative on top of that data here. So we tend to separate a lot of our work around the entry and work into the adult social care services, but also with our partners, and you'll see that the majority of the stats that we have here are mainly around adult social care, but we do have some of the stats that shows us where referrals are actually coming from, which is across the partnership. Now that's something that I want to see change in future years, where we'll get much more access into the data of our partners beyond adult social care. But it's fair to say across most of the partnerships across the whole of the country, the vast majority of data which is analysed and scrutinised tends to come from adult social care, which I know Kerry sitting around the table, he probably thinks this is hugely unfair, and it probably is actually. So we're working on making that change over the forthcoming years to make sure that we have a much better narrative that comes from our health colleagues and also our police colleagues, but also across the whole of the partnership, in which we've got over about 20 partners in total. So we need to make sure in future that data is a bit richer from the partnership as a whole. But we are where we are, and this is an improvement on last year, I have to say, but we'll take you through what this data is actually telling us about safeguarding and kneeling so far. But the majority of this comes from our adult social care partners. So, and it's kind of split down between the number of concerns that come in to the council and the number of those concerns which turn into full-blown inquiries. And you'll see that first couple of graphs that we have on page 7 is showing that we're seeing the number of concerns actually increasing from last year, and that the number of those concerns which turn into full-blown inquiries is also increasing within that as well. And the second graph actually shows us that conversion rate. So you'll see that out of over 2,000 concerns, we actually turned them into Section 42 inquiries of about 493. So there's quite a significant imbalance in the number of concerns that come in that actually move on to full-blown inquiries within there. Now, I think that's something that we need to address, and some of our reviews have highlighted this, that there may be a number of inappropriate referrals that are coming into the services, which we need to correct within that, because it causes a huge amount of work, and that work could be undertaken in doing some further preventative work. Now, the concerns they're not just rejected, if you like, but they are worked on, and there will be some undertaken to reduce that level of concern. But the number between the concerns and the Section 42 inquiries is quite stark, and that's a piece of work that we'll have to take forward within there. It's quite encouraging to see the number that actually reach closure within there, and we've also got evidence later on in this report of the level of risk which is reduced within that, and I'll get to that in a second. On the second page, we go through where those concerns are coming from, and you'll see from this graph here that the vast majority of concerns are actually coming from our health colleagues and also the police, but in the vast majority it's mainly health colleagues that come through it. And a number of these factors in the graph, you'll see we've got London Ambulance, and also we have mental health, and we've also got other referrers coming in from GP. So collectively you'll see that the vast number of concerns are actually arising from our health colleagues within that. The next section goes on to the demographics, looking at the age and the gender of those concerns, and that really just gives it a bit of a picture as to where our safeguarding issues lie within the population, and also the demographics. And I think this report is the first time that we've actually compared where the safeguarding concerns are arising in terms of ethnicity, and actually compared that with the actual populations, different populations from different ethnicities. And we can see there's a fair match there, which is quite reassuring that we're not seeing an imbalance of the number of concerns coming from one particular ethnic group or otherwise. So there's a fair balance that we get coming in. So that's a bit of reassurance that we've taken from that. The next section is looking at where these inquiry types are coming from, the locations of abuse that are actually coming through, and you see that the vast majority of them are actually coming from people's homes. So 48% of all inquiries are actually coming from people's homes. And if you look at the type of inquiries that we get, the largest type of abuse that we see is self-neglect within or neglect by others. It's at about 36%, so well over a third of those referrals are coming in to do with that. Then the rest seem to be spread fairly equally within that, with self-neglect and physical abuse coming in there too. What is of interest, I think, is those the sources of that abuse. And you see that our nursing homes and residential homes are probably the next ones that come in from the sources of concerns after our own home. On the next page, we've seen a bit of a comparison between other colleagues across London, and you'll see that we compare in Ealing quite closely, if not exactly, and some of the outcomes with the rest of our colleagues and other partnerships across London. And in fact, if you look at the number of safeguarding concerns where the risk is reduced, we hit 92% all over. So risk removed and risk reduced, adding up to the 92%, which is exactly the same as the average for London within there. So we are comparing well with our colleagues. The last page is really looking at the application of deprivation of liberty, where we have to actually remove an individual's liberty because of their significant needs around their mental capacity within that. And this is a measure that we look at to make sure that we've got it right. And you'll see, actually, if you look at the last one and the outcomes, you see that the vast majority of actual requests for deprivation of liberty were actually granted, which again is quite reassuring for the staff, how they're actually operating really in that. The document then goes on after the stats to actually look at the number of safeguarding adult reviews that were undertaken. And we're giving a little bit of a synopsis to allow the readers to see the type of reviews that have been undertaken. Now, 3 of these reviews that we've reported on were actually commissioned in 22-23, but they've been ongoing since that. There were some others that were commissioned in this year, 23-24, that we're reporting. And again, looking at 24-25, we have completed the reviews. We've created the action plans and got the learning and the improvement plans to come out from that, but we're still ongoing with the changes to practices within that, and we continue to monitor that. We expect that at least 3 of these plans will be complete before the summer, and the others will continue for the rest of this year and probably into next, to make sure that we can reassure ourselves as a whole practice and a whole partnership that those improvements have actually in place within that. The stage that we want to get to, that we haven't reached as yet, is to start to look at some of our earlier SARs that we've taken several years ago. So we want to start auditing some of the recommendations that have been put in place several years ago. And we recognise there's been significant changes in all of our services with new personnel, new structures and new demands coming in. And the Safeguarding Board itself has to assure itself that these lessons remain in place in the longer term. So that'll be a further piece of work that we'll undertake in the forthcoming year. I won't go into any of the detail of the actual SARs themselves, but every one is a tragedy in its own right within there. And it's important for the individuals involved and the families involved that we can actually demonstrate that the learning has been taken and put in place, so that risk overall is accepted and reduced within there. The report then looks at the contribution that each of our partners have made. This is a new inclusion for this report this year. So we've gone to all of our partners and actually asked them to report how have they progressed safeguarding practice within their own agencies over the year, and there's reports on each of them, or there's a paragraph on each of them there. And the report as it stands overall is looking at the collective input from all of the partners under a multi-agency approach that we undertake. And ending in a conclusion, really, and I've reported here previously that the importance for us within the partnership is perhaps looking at the overall culture that we have between partners. One of the demands that we have is that every participant, every member of the board represents their agency. So they will be explaining how they maintain safeguarding and promote safeguarding through their own offices. But the second role, which is probably more important to give a collective assurance, is that we join together to form the scrutiny of all of our services collectively to ensure that we are reducing the level of risk across the whole of the borough within that. And so that second role that individuals come there is to be able to challenge and be able to investigate and interrogate the work of other partners there. Now that can only be done in a collective and understanding and transparent culture. And that's what we've been working very, very hard over the last year to create. And it's not something that comes easy, but I am able to give this scrutiny board, as well as our own, some reassurance that we have made significant strides, I believe, over the last year to create that culture that's coming through. And that's done through the multitude of different routes that we have in those boards and subgroups that we have just now. And I think the greatest level of evidence that I can provide here is the input that I've received on each of those safeguarding adult reviews. The culture that pervades on each of them is a real openness to receiving challenge and giving challenge on practice within there. And if I just close on one area of development for the future and for your new co-optees that are on this group, I've given in the introduction to the report a note of gratitude to the number of carers that we have within the locality of Ealing and the support that they give. We would not be able to provide the level of safety or the level of care that we do without their support. And we're looking to see how we can actually support more individuals like this over the forthcoming year and to acknowledge that within our future strategic plan, which we'll be developing in the next couple of months within there. So it's just to give that level of acknowledgement, because the report itself only mentions this in my introduction to the overall report. So it's an area of growth that we want to develop over the forthcoming years. So hopefully I've given you a bit of a picture as to where safeguarding stands within Ealing and the involvement of the partners and the level of work that we're undertaking and the stresses that are actually currently on the systems at the present time. But I'll close there, Chair, and open for questions.
Thanks very much, Robert. Really appreciate the report, and I think you probably say it all in the last line of the report, which is about safeguarding being everyone's responsibility, and I think I would underscore the importance of that. Happy to open up for questions from colleagues. We've got about 30 minutes for questions, so I'll come to Councillor Steed and then David Crawley and then Goulet for the first round, and I'll take the other questions a bit later. Councillor Steed.
Thank you, and thank you, Robert, for your report. I've got 2 or 3 questions here, but they all kind of bunch together, and it's to do partly with the funding. And I hear what you say, and I think previously we've raised the issue of the contribution or lack of it from the police. But anyway, your total budget to me doesn't actually seem great, in as much as someone is going through presumably an initial review of the 2,244 concerns that have been raised. So who physically goes through those 2,244 and gets you down to a figure of 5,493 or whatever it was for review?
Okay, so the funding that's there is the funding for the partnership itself. So it's for the back office, if you like, which is really just myself and a business manager, plus how we actually bring the partnership together. The actual whole work of safeguarding is huge. It's much bigger than us within that, and that takes all of Kerry's budget in adult social care. It takes our health colleagues as well, and it takes the police. So the actual funding that goes into adult safeguarding within the borough is probably a more accurate question to ask me, and I haven't got an answer for it, which is a bit unfortunate. Kerry will be able to tell you his budget back to front, I'm sure. But getting a collective across all of the work that's undertaken in safeguarding across Ealing is going to be several million, well, more than that actually. It's going to be in hundreds of millions across all of that. The work that we do is to give you an assurance. So we undertake scrutiny, and for that, that is a small amount actually, because I think on average a board would cost about 200,000 elsewhere. So we're a bit below the average cost of a board and the functioning of it. But it's not. We don't do the casework that's actually done. That's elsewhere. What we do is have a microscope over the top of it, making sure that the processes are in place, and that's what costs about 200,000 to do it. So whilst we might not have as much as we like, we're not far off it, basically.
Councillor Steed.
Sorry, thank you very much. So can I then ask Kerry Stevens, I mean, how much budget do you have to give to looking through these 2,200?
Thank you, Councillor Steed. So as Councillor Weston mentioned in his introduction, all the work of adult social care includes a function of safeguarding and a responsibility to supporting vulnerable people and protecting them in the community and responding to concerns where they're raised. The vast majority of the adult social care spend is on procured services. We have contractual arrangements, we have programmes of work to ensure that the individuals in receipt of those services are supported as best we can, but also to responding to issues as they arise. The flow of the demand in terms of the inquiries and the concerns that come into the service are dealt with by social workers and other care staff throughout the system. We're currently reviewing the workflows in light of some of the comments that Robert's made with regards to the concerns turning into inquiries, and looking at how we can be more effective in terms of triaging the concerns before they turn into an inquiry, and therefore diverting them to other workflows within the service. There's no specific number because it's all the spend in adult social care will be considered part of our safeguarding response, and that's everything from home care hours that we provide and making sure that we procure with good and outstanding only providers in the borough, to the contract management functions that we have in the organisation, to the training for the teams, to the systems to make sure that we've got good and effective oversight and support for all staff.
Okay, so one last go.
Can have one last go, but then I'm moving on.
Yeah, okay. So a member of your team will raise a concern. Yeah, I'm just trying to get my head around the process, if you like. A member of your team will raise a concern, and then another member of your team will look into that concern, or how does that work?
So what tends to happen is that we receive concerns raised from outside of the organisation as set out in the report that sets down where the majority of the inquiries and concerns come into the organisation. We'll then go through those concerns that are raised with us. We'll triage them and respond to them, and those that require a greater level of investigation will go through a Section 42 inquiry that's led by social work staff. It's clearly set out within the Care Act and our statutory duties that it has to be a social worker that leads on social work, on safeguarding investigations. So there's a clear process that we follow. I can share you the workflows and everything for it separately, Councillor Steed, if that would be helpful.
Yeah, that I think it would be beneficial just as background information, so thanks. I'll come to David next.
Thank you, Chair, and thank you, Robert, for the report. As we're on the subject of sources, that 2,000 number, I would be curious to see, and I don't expect you to have this on you, the distribution of which referrals from which sources actually lead to inquiries. If it's even amongst all sources, or say if mental health staff members, more of their alerts turn into inquiries? I think that'd be good background information to know when we aim to streamline processes. Thank you.
Robert, I'll come to you. Yeah.
Okay.
Thank you.
Thanks, Chair. Thanks very much for the question. And I think it's a very pertinent question, actually, and I think it's something that we'll be looking at over the year. We have got that information, but I think it's well worth a further review, actually. So when we're looking at what this report has highlighted, that there's a huge amount of pressure that's coming in the front door, and some of that is obviously appropriate, and that should actually go through to the full Section 42 investigations, but also there is some response to those concerns in any case. And then some, there's no further action, or they're taken back by the referrer within there. So what is interesting is if there is any discrepancy between any of those sources that might be getting it wrong, and that there is a desire from some of the referrers to actually know about the referrals they're putting in, are they appropriate or not? And we picked up in some of the reviews, the safeguarding adult reviews, that feedback loop has been missing in the past. And what we need to make sure is it's there so that people can actually learn what they should be referring and what they shouldn't be. Particularly for the front door at social care, because it's too busy. You know, we need to make sure that we can maintain that. And there's other routes for support. So our health colleagues in our place and the vast array of partners that we have may be better recipients of those concerns than adult social care, for instance. So I think it's a very good question, and I think it's a task for us over the next year to be able to identify that so we can rectify some of the changes, actually. So I think it's a good point of inquiry for us.
Thank you. Gule.
Thank you. My question would be about who's responsible for the safeguarding. That would mean prevention, protection, and accountability. And the best way I can ask this question is about giving you a case study. And that would be, given that many disabled individuals require more than 4 incontinent pads per day to maintain basic dignity and hygiene, how does Ealing Council justify this restriction, and what measures are in place to ensure that this does not lead to neglect, increased health risks, infections, urine infections, skin infections, and or undue financial burden on the families and carers? The bowel and bladder services, for example, have got a one-size-fits-all, and that's where the risk comes in. So who is accountable for it? I've been with my sibling to the hospital. The first thing the hospital staff do is check the pressure area, start taking photographs, and I've been told off many times why there's skin damage, why there's muscle damage. Who is accountable for that then? And who do we hold to responsibility to look into this?
I was just going to say Kerry's indicating in the room, Robert, so I'll go to Kerry first, if that's all right, and then bring you in.
Sorry to cut across you, Robert. It's a great question, Gule. Incontinence services are the responsibility of the NHS and provided through West London Trust through the community nursing contracts. I think we can take it away. Certainly, I can have discussions with Robert separately, and we can feed that into the Safeguarding Board's work programme. I think there have been a number of times that concerns have been raised with regard to the quality of the Inco pads and the regularity of replacement pads and the impact it has on people's skin integrity. But maybe it's something you wish to bring back here as well, Chair.
Yeah, I think that would be helpful. Robert, did you want to add to what Kerry said there? Yeah,
if I can, that'd be good. It's an issue that was raised in one of our SARs fairly recently, actually. Well, last year, I think it was within there. And it came about through pressure sores. It wasn't a SAR, actually, it was a review that we undertook. It didn't meet the SAR criteria within that because the agencies involved were doing what they should have done, really, but it still led to a really unfortunate incident. So we still undertook a review, but it wasn't a full SAR. One of the recommendations from that was around communications with how communications happen between the health units that Kerry's just told you about, also with carers and also with private carers or unpaid carers as well. And where the communication fell down in this case was actually at the household itself. So there's communication going on between all the services around this particular individual at this case, but it was falling down between some of the home carers or domiciliary carers and the people who are providing the skin viability resources there, and also the district nurses with there, and also the family within that. So on the back of that, there's been a significant piece of work undertaken, and we have just managed to agree the publication of a booklet from our health colleagues, which will be placed within everybody's household within there, that gives information about how we can actually look after people's skin around that. And part of that is around continence and the use of pads and how we might actually improve that. And we had a launch actually yesterday, so it's been a long day. We actually had a launch of that recently, when we had about 50, nearly 60 people in attendance, professionals in attendance, and we had a couple of three carers present within there, as well as social workers, as well as health colleagues and others. So we are looking upon this issue in the round within the practitioners, but there is a unit who are responsible for this within our health colleagues, as Kerry said, within there. And so we're looking to support them as much as we can across the whole of the partnership. And it's trying to make sure that communication takes place. In the booklet itself, at the back of it, there's an area where the family themselves and individuals can write their concerns or what they would want to happen. There is issues for our health colleagues to put in there, and also for carers. So we have that communication now in place within people's household. It's where you want it to be, really. So we recognise that from our safeguarding adult reviews. It's now into practice, and we will keep an eye on that over the forthcoming year to see how successful or otherwise it is, really. And I think also within that, there's an avenue for you to raise any issues that you have through that route, and it's probably better to sort with individual practitioners. But if it is a wider issue, then yes, we can raise it up at the board or bring it back here, Chair, next year.
Thanks very much. Goulet, is that okay?
That's fine. Just one more question. I've just spotted, like, with the Ealing Council safeguarding adult courses and the NHS and WL ICB courses, there is nothing about carers' rights. So what happens, like, we've got a lot of international staff coming in, working in hospitals, and they come from that part of the world where caring responsibility is just part of family life, and they haven't heard about the carer rights, are not aware of them. So you have to have something in your courses that actually brings the attention towards the carer rights and their advocacy and how to handle carers in the UK, which is very different from how they're handled in the Asian countries.
Thanks, Robert.
Thank you.
Yeah, I think we've got a number of issues with our the courses. So we've reported in this paper, this report, around the training and the learning and development programs that each of the services have done. I think there's a lot more that we can do. The services do an awful lot, and that's what we reported here. I think there's something for the board to take away from us and our learning, is that we need an overall learning development programme, I think, for safeguarding. Some of the areas that you talked about would be pertinent to an individual service provider, perhaps, and the staff that they get. So their learning and their training programmes should stay with the provider, with the agency. But when it comes down to safeguarding, I think there's some there should be a drive from us as a partnership overall around safeguarding that involves all of the services and allows better access to that. And I think there is more that we could do with carers directly as well. So I think it's something that we've acknowledged, I've acknowledged, and it's an area that we want to develop further within there. So again, it's a great question to ask us, and it's a great question to minute and for me to actually pick up next year.
Lovely, thank you. And Kerry, you just wanted to add to that?
Just to add, in addition to what Robert's saying around training, that we've got very clear arrangements in terms of contract law when we're procuring services, and expectations of employers to be good employers to people coming to this country to work. We've also got very strong commitments to prevention and reduction of modern slavery through the Safeguarding Board, but also through the council as a whole. So there's there's training opportunities as Robert sets out, but there's also real human rights issues and contract and protections for carers coming to the country to work.
Thank you, Kerry. So next round of questions. So I've got Councillor Crawford, and then who else is Councillor Conti, and then Alan after that. So Councillor Daniel Crawford first. Thanks.
Thank you. Firstly, obviously, thank you for the report, Mr. McCulloch-Graham, and it's very detailed. I'd just like to associate myself entirely with what Goulet has just outlined. We are, as a council, nowhere near where we need to be in recognising the role of carers, and I realise that I'm speaking for, or perhaps on behalf of the carers champion, but most of you will realise why I might be doing that. And I think it's absolutely positive, Chair, that Goulet and Connor are here as co-opted members, and in fact that they co-chair these co-production boards is a very positive development, but it's only a recent one. I would ask, you know, when was the last time the carers champion had a role in the safeguarding review processes? I don't believe it has happened for at least a decade, and that will go back before people's times on this call. I don't want an answer right now, but perhaps we could look at that. My question, though, is actually about the role of independent domestic violence advisors, because this comes up time and time again in section 9 of this report, the board partner achievements and challenges in 2023 and 2024, and it relates, Chair, to the issue that Mr. McCulloch-Graham has referenced already, which is partly the funding issues for various agencies. I've done a little calculation as to how much each agency spends on safeguarding, and it comes to £197 million for the financial year. And I think that's an underestimate, actually. That's just what I could pull off while this discussion was going on. But when I look through this paper, it says that NHS West London NHS Trust doesn't have a independent domestic violence advisor. There in the section for the NHS London North West University Healthcare NHS Trust, it says that Northwick Park's IDVA left after only a few months in post, and we are finding it difficult to recruit via victim support, and that there is no equivalent person at either Ealing Hospital or Central Middlesex Hospital. And there's another bit somewhere, and I'm very concerned simply that we have a stated aim as Ealing Council to counter domestic violence as well as violence against women and girls, and that this is probably nobody's fault in this room, but just on domestic violence alone, we are way short of where we need to be when we consider that some of this is a contributory factor. And I wonder what we can do about it, because I'm sure everybody would want to recruit more and do more, but it's a funding issue as well as an organisational issue if we're having to ask all of these different agencies to step up. Thank you. Sorry, Chair.
Thanks. Robert, I'll come to you.
Okay, thanks very much. There's lots of ways of answering this question, Councillor Crawford. So the issue of the IDVA is actually with the employing services there, so I can't answer that directly. However, what I can do is actually talk about domestic abuse and the prevalence of domestic abuse across Ealing, and a priority that the board of services, the partnership of services, have recognised that it's a major objective for us, and it's a major priority for us collectively within that and how we deal with it. And a few of the safeguarding adult reviews have demonstrated that. One of the most recent ones has demonstrated it fully, and it's become a very, very live issue across all of the agencies. I can say that most recently there's been an appointment of an IDVA at, I'm going to get this wrong now, London North, the NHS Trust of London North West. So they have an IDVA in place now, and that's quite a recent appointment there. They've also undertaken a massive campaign through that organisation, which is tied in other services too. And it's based on a piece of work that's undertaken in Cumbria across the agencies there, and they've lifted that and brought it down to Ealing because of its success. And so I think what I'm trying to say is what you've questioned has been acknowledged across the partnership, and we are aware of it, and people are doing putting the shoulder against the wheel now and actually making sure that things are being done. So there's an absolute programme going across the partnership now, which has been led by Ludmilla Isbian from LNW NHS Trust, and she's leading it at the moment across there, and she's got brilliant tie-in from all of the services and doing that currently within there. And I can give you an introduction if you want outside of this meeting. I know she'd be delighted to actually tell you the service she's doing. That's not to say we've got it sorted. We're a long, long way from getting it sorted, but it will be a priority for us moving forward.
Lovely. And Councillor Crawford, you want to come back?
Thank you. I appreciate the candour of the answer, and I wasn't trying to suggest that nobody was acknowledging or acting on the problem. I know that's not true. I don't know that we can recommend things, Chair, and I'll defer to you on that. But I think there is an action in respect to the Metropolitan Police and the role that we have as local councillors in regards of our work with the Metropolitan Police, because the documentation that the police have provided, not just in this forum but in others, suggests that the West area and indeed the whole of West London is a hotspot for domestic violence. Now, not all of that will come across Mr. McCulloch-Brown's desk, or sorry, Mr. McCulloch-Graham's desk, forgive me, or Kerry's desk, or others, but I think we can be in a strong position as local councillors and community leaders to reiterate to the Metropolitan Police that this is an area that needs further attention going forward. Thank you, Chair.
Lovely, and I will come to recommendations at the end. Councillor Conti.
Thank you. My question was about multi-agency working, because when looking at a lot of the case studies, there's sort of a theme about how information is shared, whether it's the case of Owen, which is how information is shared with health practitioners, or the next one, which was about sort of strengthening a multi-agency approach to welfare checks, and it goes on. There's sort of a multi-agency aspect, or I guess failure or issue in each of these cases. And I think when you hear about sort of other cases in the news, etc., that have made sort of national headlines, often it's how that information is shared. And obviously in lots of different ways, different organisations sit together on different boards, etc. But there clearly seems to be a consistent problem with how information is shared between different organisations. And I just wonder your views on why is that sort of the way technology and different systems that are used in different organisations? Is it how information is captured? I just wondered why this is sort of a common theme that sort of recurs again and again, and it's something that we generally don't seem to get on top of. I'm not just saying here in Ealing, but I'm saying more broadly.
Robert, I'll bring you in.
Okay, thanks. I can give another candid reply to this as well, actually. So I've been in the business well over 40 years now, and I've been dealing with communication issues every one of those 40 years that I've been actually doing it. And it's a huge struggle for us to do it. And there's a multitude of reasons for that. And I can list them all off here. I think there are a couple of occasions in my 40 years, and now is another one, where there's a real desire that barriers to information sharing should be knocked aside. Yes, we've got to appreciate people's rights to privacy within this, but when we're actually talking about the safeguarding of individuals within this, we have to look for the better good, and then we have to move on that. And I think this government in the moment, and the way that they're moving, is actually recognising that through the agencies of the Health and Social Care Department, and also within the Education Department. So I think we'll see some legislation coming out which will help us. It's not that long ago when we tried to create the contact number, which was scrapped, and that nearly got us to a place where we could easily identify individuals. And I think we're going to return to that. And I think that was about 15, maybe even 20 years ago. It's what happens when you get old, really. So the issue has been around for a very long time. Other areas that we need to be clear about, though, sometimes it is just down to individuals thinking that they can't share information. We need to get messages out when people can share it. And the example I gave of the tissue viability in the continents earlier and pressure source within that, we've identified that the block on that was not so much between the services, it was actually around individuals when we had a number of agencies coming in and trying to do their utmost and their best, but the communication wasn't crossing across lines. So the booklet is a real attempt to have something which is very practical that allows that communication to take place. So some of the answers I'm trying to say is that communication doesn't need legislation all the time. It just needs a process for individuals to be able to look at a situation and to be professionally curious around what's happening in a household or with an individual, and then start talking to the other service which is involved. And it is a case of tying them up. And most, if you look at where our abuse is taking place, it's in people's homes. So where are the services going in? What are the services going in? So you have housing, you've got police, you've got adult social care, you've got health, you've got GPs, you've got district nurses, all going into these households within that. So a multitude of services coming in. They need to be able to talk at a very local level around issues, and they need to share it. And some of the reports that I've gone through in the last couple of years, not just the kneeling, are really illuminating around where individual professionals are not looking beyond the limits of their own profession. They're not going into seeing what the other problem is. They've gone in a single issue to a household or a single person within that. And when there is other abuse or harm or danger within that household, they need to have the confidence to actually raise that and move that on and know how to do it. And that's where the information needs to be able to be transferred. And where legislation is blocking, we need to challenge it and remove that block. It's crazy that legislation would stop that transfer of information. That's just daft. But the hardest thing actually is between individual practitioners. And we need to get back to that to free them up so that they can actually ask the right questions beyond their own profession and talk to other people out with their profession and actually get the best result for a household overall. And it's actually getting that practice in place. That's what's really important to do. And I think it's a bit of a campaign we need to do actually. So it's, again, all of the questions tonight are really helpful, Chair. So maybe before I do the right strategic plan, maybe we can have another session here and we can get the right questions and actually help us actually develop that.
Thanks, thanks, Robert. Kerry, you wanted to just supplement the answer.
Thank you. Just to add to what Robert's saying, certainly on a kneeling basis, there's a lot of work around the 7 towns model and how we link that up with the integrated network teams, which is going to be the NHS's framework for having integrated services on a more local level. And as Robert says, getting that connection and engagement between professionals operationally, where it works really well, it's fantastic, but where it doesn't, there's big chasms, and bringing people together around patients, individuals, streets, towns, villages is the real way forward. So the integrated network services in the 7 towns programme will helpfully bring that more closely together, Councillor Conti.
Super, thank you, Kerry. So I've got Alan, then I've got Councillor Kate Crawford. Are there any other indications? Because I think we'll bring the conversation to a close. I do have one question myself. Alan, I'll come to you.
Thank you. I assume from the data that you've presented that some filtering occurs between the health sources that put forward the information to you. And in particular, I'm concerned about LAS, which has 189 concerns, which means that the number of individuals involved in that could be much lower. However, I've seen data on a regular basis from LAS's 111 service, which has approximately, during the same period of this report, 162 individual referrals for safeguarding issues. And I wonder how that fits into your report.
Sorry, can I check, Chair? Is that okay?
Yeah,
are you referring to the London Ambulance Service?
Mm-hmm. Yes.
Okay.
Because they run the 111 service at the same time.
So these are referrals that come into adult social services from that service. Now, the London Ambulance Service might refer elsewhere within there. And going across the different providers of concerns coming in, there is a filter because some of these agencies deal with safeguarding issues in their own right, that they don't need to refer on to adult social services. So they only refer on where they need a response from adult social care. So some of these cases will be sorted at source within that. So you don't see all of it. So there is a degree of filtering here. I think what we have to get to, though, in the future is a better representation, because as I said at the outset for this, the vast majority of the information here is adult social care information. We need to be getting more information from our colleagues so that we can better represent that here. But I'm happy with this year that this is a big improvement from last around what we are presenting. I hope it's another step change next year when we get around, when we actually can see more of the data that's behind this.
Alan, any follow-up? Fine. Councillor Crawford, over to you.
I think what I see as a councillor and living in London, I don't know my neighbours, and I hear too late when things have gone wrong. So, and I witnessed something which was, quite a concern, where an elderly, vulnerable resident was receiving care from an agency. And when they couldn't access the property, I was outside, asked if I could help. But I found that the actual carers couldn't speak English. And when I said we phoned the police, they couldn't actually, they had not had the training on what information to give to the police. And so I did the due diligence. And then I was brought back by the fire service to look at how the place had been, was left with had care staff agency. And what I did hear was that there was no one, there was no service at the weekend, and I think this was like a Monday. And so the recording of information by our agencies, I'm interested in knowing what monitoring is done, because obviously the training was can be inadequate. I hope that is a one-off instant. I suspect it's not. So it's how can people who want to probably want to do their best, but if they can't speak English, they probably can't record information, and also they cannot communicate the need to trigger a review. So what work? So I'm just asking. I'd like to ask what work is being done. Thank you, Kerry.
So Kerry is indicating in the room, and then I'll come to you, Robert.
Thank you, Councillor Crawford, and I'll be happy to look into the specific incidents that you're referring to. But just to be really clear, the contracts that the council holds with care providers has a mandatory requirement that people can communicate both in written and verbal in English language. Otherwise, it's very difficult for people to provide care and to work closely with other professionals. So that is a requirement and expectation that we have of our services. All the domiciliary care services that we procure as a council are only commissioned from good or outstanding care providers under the CQC inspection and registration programme. So I think we've got high standards, and that's why I'd be interested in looking into the incident that you've raised, because that does raise concerns. Obviously, we're not the only organisation or organisation, and individuals can procure services directly themselves, so it may not have come through the council, but I think we should be very proud in Ealing of the high standards of domiciliary care provision that we have.
So the question I'm really asking, is what monitoring is being done?
So Councillor Crawford, I'm going to bring. Sorry, I'm chairing the meeting, so I'm going to bring. I'm bringing Robert in, and then I will come back to you.
Okay, I think, to be honest, Kerry's answered the question. With regards to monitoring, what I can say is I've attended some of the meetings that Kerry chairs, around monitoring the provision, both in domiciliary care, but also in residential care as well. So that level of oversight and eyes on, I'm quite satisfied. I satisfied myself and I satisfied the board that that level of scrutiny is undertaken there. There's a reliance on CQC, but beyond CQC, the regulator, Kerry's staff receives reports on that from the level and the quality of that, and that's undertaken. But having said all of that, we know that it's a good service, an outstanding service, and what the council commissions. But the exceptions to the rule are always the test for that. So it's good to hear those individual cases, and I think that's what Kerry was indicating, that he'd be interested to hear what that case was, because it's always a test for us when we hear from individuals and individual cases within that. And that's why our safeguarding adult reviews are so important as a lens into practice. But looking at the level of scrutiny that the council undertakes for those providers, in my role, I had to satisfy myself as a scrutineer that that was taking place, and I did, and I witnessed that firsthand in person.
Thanks. Councillor Crawford, any follow-ups? No, lovely. So final question is from me. I've waited very patiently for this. It's just in relation to the shortfall of just under £50,000. And I noticed that the police in particular are, and I think, Robert, you mentioned this, are contributing a relatively small amount compared to the other partners. And I just wondered what kind of actions there are to address it. I don't know, Kerry or Robert, who's best placed to kind of take that question. Kerry?
Quite happy to take it up.
I think Kerry is indicating in the room.
It may be more diplomatic if Robert goes first, because I'll just moan about partners. So maybe Robert gives you the more strategic view, and
Robert,
give you the moaning
we'll
down.
come to you for the strategic view, and then Kerry's going to rant, I think, but not for too long.
Okay, all right. Maybe should I go on silent when Kerry speaks? Maybe. I don't know. Right. So this is an issue not just for Ealing. It's across every borough, every partnership rather, in London, and it's been historic for over a decade, I think, and it does not exist outside of London. So the level of funding that comes from the Met into both children's safeguarding partnership and to adults safeguarding board is £5,000, and it stayed at £5,000, I think, for 10 or 15 years. Now, it has been challenged locally, it's been challenged across the capital, and it's been taken up by chief execs, by directors of children's services, directors of adult services. It's been taken up by board members. And I have to say that the response we get from the police is always, yes, we recognise this is an untenable position and we will change it. Now, I've been a board member for 3 years and I had that conversation in my first week. So I'm still knocking at the door. So I think we've got to raise this question a bit further, and I'm independent, so I probably can say this actually. Perhaps it's more of a political question, and perhaps taken up by political leaders there, because I think we've exhausted the professionals and the professional leads going back to the organisations to do it. But if I can just give you a comparison outside, so I also chair a couple of boards in the north of England, and their proportion of their funding is probably around 10, maybe 20 times as much as not 20, sorry, I get my maths right, I am a maths teacher. It's about 10 times as much, and that's the police forces out with London. So there's a real discrepancy across the Met.
Thanks, Robert. Kerry, did you want to add anything to that?
Thank you, Robert. I think the Met and also the contributions from the NHS, once again, in local government, we are expected to carry greater levels of cost and pick up additional pressures when the funding for the NHS is significantly larger in terms of increases compared to what we've been receiving in local government in this space. And each year we've got statutory duties. Robert's got statutory duty. I have statutory duties, and we spend significantly above what the budgeted amount is because we're having to commission independent sales investigators, etc. But we bear the cost as a local government in that space.
Thanks, Kerry. Just in terms of recommendations, it would be my proposal that myself and I'm nominating Councillor Newstead might well write to the agencies concerned with the plea for them to up their contributions, maybe drawing on some of the material that that Robert alluded to. Is the panel content with that? I do have other recommendations as well, but that in particular, are we happy with? Councillor Crawford.
I am happy, but I think, if I may say, I wrote a similar letter, I believe, some years ago, about the funding devoted by both Metropolitan Police and the NHS, to Kerry's point, as the chair of this panel. I didn't even get a reply from anybody. I'd hope we've moved on since then, but I would just say we had a crime and justice panel of this council last year. We're in the new Met for London turnaround plan, whatever it's called, this week. The Home Secretary on the floor of the House of Commons this afternoon spoke about the need for more funding for the Metropolitan Police for these types of investigations, and we do have a Mayor of London and a government that's, as Mr. McCulloch-Brown has identified, is speaking to these issues. And I would just say, Police Scotland, for instance, contributes substantially more. It's a different funding arrangement, but I think there's real justification.
So I'm going to bring the conversation to a close there. Robert, can I say thank you to you and your board for all of the work that you've done over the year. We've seen real, I think, progress in terms of particularly the report and the information that we've received. So thank you. There were some actions that stem from the discussion there. So Kerry, I think you were going to supply a process flow around safeguarding related concerns by way of background information. In your reporting next year, Robert, we'd like to see some information, some more focused information about which organisations are referring and when that leads to particular inquiries, just a bit more granularity around that. If the skin integrity booklet could be distributed, I think that would be really helpful to panel members. And Goulet, if there's anything off the back of that that you want to specifically raise, I think that would be very welcome. We are going to submit the letter in terms of funding contributions, and I think I've captured everything unless anybody else has another recommendation. So Councillor Crawford and then Kerry.
It's just I realise you talked about the skin integrity part of what Goulet was mentioning, but I do think several contributions were around carers in particular, and I suspect the Carers Co-Production Board and other bodies might want to take it up. But I do think that's really important. I think carers and the role of kinship carers and also the domiciliary care agencies, to the point that Councillor Crawford was making. You know, we need to. They have a specific role here, and I'm not sure it's adequately reflected. Forgive me, Mr. McCulloch-Graham. You answered the question very well, but I think we need to find a way of lived experience being reflected in the processes of these bodies, and so a recommendation around that I'll leave you and Councillor Steed, Chair, to look at would be appreciated. Thank you.
Yeah, we can see how we factor in lived experience for sure. Kerry, final word.
I was just wondering whether we could ask the Scrutiny Committee to look in more detail into the incontinence services. I know we discussed the leaflet, Chair, but I think something about questioning the NHS with regard to what the current offer is that viable, and is it suitable to meet the needs of people in the community?
Absolutely. I think we will add that to a potential agenda item for next year's work programme. So thank you very much. Right, I am going to move on. Otherwise, we may well be here until. Oh. Because our streaming has. So I'm just informed that our streaming has stopped, and we are going to take a brief pause. Robert, you are of course free to leave at this stage if you wish.
That's very kind, and thank you very much for the comments and questions from members. Very, very appreciated. Thank you. Good night.
Thanks. Good night. So colleagues, just to say that you can still be seen, but it's not streaming on YouTube. So just bear that in mind. Colleagues, can I just say we are now still live streaming, so we will resume. I know we're a couple of panel members down, but I think we'll start the next agenda item, because otherwise we're going to fall even further behind. So the next agenda item, which is agenda item 9, is the update, bless you, on adult social care provider services, the Better Lives, Better Days projects. So I'm going to invite Councillor Newstub as our Cabinet Member for Healthy Equal Lives, and Kerry as our Strategic Director of Adult Social Care to introduce the report. The report provides us with an update on the progress of the project, which explores new ways of offering daytime activities and support for people with assessed adult social care needs. So Councillor Newstub, I'll come to you first, and then Kerry, you afterwards, and I'll take questions as we normally do from panel members after that. So Councillor Newstub, over to you.
Thank you, Chair. I'm not going to go into it in huge detail because everything's there. This is really intended by way of a briefing. Very conscious that we've been consulting with those users of our current day services, staff and carers and families for some time around proposals for improving those services. We've briefed internally as our backbenchers within the leadership group and our opposition members, and we're just very conscious that we wanted this forum to have oversight of the project. It's not a report in that we don't yet have conclusions or recommendations. They will be coming through in a cabinet report likely in April. But I'll pass over to Kerry to really kind of talk through the nuts and bolts of the project. But it's something we're really excited about in adult social care. Actually, I think it's a really fantastic opportunity to engage very meaningfully and improve the services that we currently offer.
Thank you very much. Kerry, coming to you now.
Thank you, Chair. Thank you, Councillor Newstub. This is hugely exciting. There's a lot of opportunity here and a lot of work being done to meet the aspirations of people who live in Ealing and who use our services. We've been through a huge amount of consultation and engagement with people who use our services, with the staff working within the services, but also the carers of people who use the services, to get a better understanding of what they want to see in terms of day services provision in the borough in the future. We know that post-COVID, and I think I've discussed this here before, the uptake of daytime activities has been reduced, and therefore we think that there's an opportunity for us to increase the number of people accessing their communities and engaging with activities that are going to promote their health and well-being. The current offer, and I'm not going to go in detail, Chair, unless you want me to through the report, because I'm sure there's lots of questions, but the current model is a monolithic offer. If you're an older adult with dementia type illnesses, you go to Acton. If you're an adult with learning disabilities, you go to the service offer in Greenford. We provide services to a very vibrant and diverse borough in Ealing, and a monolithic offer makes it very difficult for us to reflect the wide and varied needs of the people who live in the borough. Some of this shows up in the maps that are attached, and you can see that there's clusters of people attending both of the sites. One in Acton, which is the Michael Flanders Centre, is mainly attended by people from Acton, and the one in Greenford has got a large number of people attending from Southall. And it's not just because there's higher levels of need in those specific areas. A lot of this is to do with location. We've got people that are on buses for up to 3 hours, which is obviously a significant quality issue for us. And we've been doing lots of work, and we're really proud to have been working with NDTI, which are a national organisation, who have been walking us through the consultation. They've had over 200 consultation and engagement pieces completed, lots of really interesting feedback, which we're going to use to develop a model going forward. But as Councillor Newstab said, we're bringing this here for discussion, and there'll be further updates coming to this meeting and other council meetings in the near future. But just wanted to give it that sort of introduction. Chair, I can dive more deeply into the information as the questions arise.
Thank you, Kerry. Thank you, Councillor Newstab. So I'll take David first, and then Goulet after that, and then Councillor Baines.
Thank you, Kerry and Councillor Newstab. Two questions. One, what does the referral process typically look like for individuals that go to either of these centres? And you mentioned there are individuals who spend up to 3 hours on buses. Is that from the Ealing Community Transport, or is that from regular Transport for London? Thank you.
Kerry?
Thank you, David. Really helpful questions. So the referral process will generally follow a route where somebody has eligible needs. They come in contact with the council, looking for daytime activities, often provide their loved ones with a break from their caring responsibilities, or to get more engagement within the community. An assessment is completed. If somebody meets the Care Act eligibilities, they then are referred to the relevant day centres, and an assessment is completed by the manager of the centre to ensure that they can meet the individual needs when they come to the centre. That's the extant process. We think future processes will be much more community focused, much more looking at how we can enable people to achieve their goals and their aims, rather than, as I said earlier, a monolithic response to a daytime need. The transport issue is people coming on not just ECT transport, but other forms of transport that are organised. It's not people arriving at the centres on public transport for 3 hours. We sometimes get into quite detailed logistical discussions about how can anybody take 3 hours to get around Ealing. And I know sometimes it can be busy, but you have to remember a lot of these buses are wheelchair adapted buses, and it can take some time people to get on and off and then move to the next site. And sometimes there's issues which leads to the long wait times for bus journeys. And these are daytime activities that we're providing to vulnerable people. This is not a warehousing service where we think it's reasonable for people to be stuck on the bus that amount of time.
Thanks, Kerry. So Gule, over to you next.
Regarding the Disabilities Day Service and its role in respite for carers, given that the Disabilities Day Service is essential for family and carer well-being, resilience and preventing breakdown in support, why are families required to arrange their own transport and escort themselves, as the carer has to escort and drop off and pick them up? And doesn't this significantly reduce the respite time for carers who might want to go to work or rest or want to go somewhere to meet family or manage other responsibilities? What steps is Ealing Council taking to address this gap and ensure transport solutions that truly support the carers?
Lovely, Kerry, I'll come to you on that.
Thank you, Gule. I think this is referring to the short break service, the respite service in Greenford.
Colgate.
It is, which is a slightly different issue than the day services report, but I can pick that up with you afterwards. Is that okay? Can I just make a comment in terms of the benefit of these daytime activities for people? Want to turn your... Thank you, Gule. I'm very clear in my role as the strategic director that daytime activities in these services are a absolute requirement in terms of supporting carers in the community, but there's also a financial impact of supporting those carers. The more support that we provide to carers through our daytime activities and through other services, the more able people are to support their loved ones in their homes, and that's a business reality. It's less costly to the council to support people in their homes through support of daytime activities and relevant respite services. That's why we're looking to expand on the offer and to make this offer of a daytime activity service more reflective of the needs of the community to support people in their caring roles. But I will pick up the short breaks transport issue because I'm aware there's been some concerns about that separately, unless you want me to deal with it now, Chair.
No, happy for you to pick that up separately, Kerry. Councillor Newstead.
Yeah, thank you. And I think it's absolutely correct that the caring role is the respite role is absolutely crucial. But what's also really important, and I'm quite, and maybe it's helpful, I'm quite new to the world of adult social care, and it's really when you go out and start talking to people. I mean, we have a daycare centre that has people who might be 20 or they might be much older, which is not to say they're not going to get on, they might, but they have a completely different array of learning disabilities, and like the rest of us, they have a completely different array of things that they'd like to do with their time. So when you start talking to people and having conversations, not surprisingly, the things that people want to do with their time are sort of much the same as everyone else might want to do. There's a lot of more demand for skills and perhaps getting into employment where that might be appropriate. That people want to go to Westfield, they want a girlfriend. I mean, all the normal stuff that we would expect. So by kind of like, and warehousing is a kind of, I guess it's a provocative word, but it's one that Kerry uses kind of advisedly, I suppose, in his professional role, by effectively warehousing people in one bit of the borough where people are taken out of their own communities and kind of, it's not what I would want for my family or my kids. So I think that is what's driving the sort of driving sort of force behind the project, and it isn't an area where we'll be looking at a loss of staff or of capacity. It's really about understanding for the longer term how we do things more effectively while retaining all of that benefit for individuals to lead rich and engaged lives as part of their communities, but also to ensure we enable and maintain the respite that those services can offer to the carers who spend so much time keeping them happy and well.
Lovely, thanks. So I've got Councillor Baines, then Councillor Conti, and then Councillor Crawford. So Councillor Baines.
Thank you both for the report. It's really positive that so much engagement is taking place within the service users and carers. How will their feedback shape the final decisions, and how can we make sure that the impact of any changes are properly tracked and reviewed? And just a second kind of question I had was about the travel. The report highlights that both of the centres are operating on a below capacity. What strategies are being considered to increase attendance, and how will accessibility, especially for those who are facing long travel times, how will that kind of be improved? Thank you.
Two great questions. Kerry, Councillor Newstead.
Thank you. In terms of the importance of the consultation, Councillor Baines, with local people, with carers and with people using services, and the importance of bringing in the independent organisation NDTI. We're going to keep them on board with us for some time so that we're held to account by a national body who recognise the importance of engagement. We will know when we've done this right, when we see increased uptake. It's really important that the service offer that we develop and move to is more attractive and more acceptable and better meets the needs of the communities that we serve, because the current reduced capacity or attendance at the centres, I think, is a reflection of people voting with their feet almost. I mean, the people in these services are very committed, the staff work extraordinarily hard, but there's just something more that we need to do to improve the uptake. So it all flows. If we do the consultation right, the service development reflects the consultation and the aspirations, and then we get increased uptake. It becomes a virtuous feedback loop, and we get more people coming to the services, and the services are more reflective. In terms of reducing the travel times, that's part of our planning, to look at options where we can develop services that are closer to people in their own communities and help them access their communities more effectively.
Excellent. Councillor Conti.
Thank you. I just want two questions. One was, is there any best practice anywhere else that we're looking at? So maybe just sort of highlight what that might look like. And I guess my second point was I think obviously the ambition to deliver things close to people where people are and give them a more sort of varied option clearly is, sounds really positive. I guess in your summary, there's 2 points which almost sound contradictory. There's that, and then working within tight budgets and getting the most cost effective, because the idea of delivering sort of more services close to people's homes actually sounds like it costs a lot more money. So how do you sort of balance those two things? How is it possible to deliver more and be more ambitious, but trying to essentially make it more cost effective? And I'm not sure if he's trying to say you want to spend less money on it or the same. It wasn't quite clear.
Welcome to my world. is the challenges that we face. I think the best practice question is a really important point, and we've been looking at where the best practices are nationally and internationally in terms of what are the outputs, what do people gain by being involved in daytime activities. And I do use the term warehousing pejoratively, because you can just warehouse people and just put them somewhere, not provide any support or engagement as a way of giving carers a break, but it's not a long-term solution. So we're looking at the best practice, and we're feeding that in through the commissioning function, and as well as our work with NDTI in terms of their learning. So it's really important. We can share some of that with you at a later date. The cost bit is really important. We're looking to do this within existing spend. But what we recognise is, as I said earlier, is the better support that we give to carers, because the people that are attending these centres are all living in the community. Nobody who's attending these centres is in an institution or a supported living environment. They're all supported in the community by their friends, families and loved ones. And the longer that we can support these individuals to be independent in the community, the less money it costs the council. The individuals who attend these centres are some of the most complex and got the most challenging lives of the communities that we serve in the community. For an older adult with dementia type illness, you're probably looking at £1,200 to £1,400 a week to fund them in a care home, and you're probably looking at double at that for people with a learning disability who attend the day centre. So it's really important that we get the balance right, that we don't reduce costs in the service, but make the service attractive enough to increase the customer base to support those families, to support their loved ones for as long as possible, because we know it's a better health outcome, but it's also a better outcome for the council as a whole.
Councillor Newstub.
I was just going to say we're pulling together a kind of a document sort of at the next stage of the briefing, really, which will be the results of the consultation and what we've heard, but also some of that best practice. So really happy to share that, obviously, with the board and with anyone who'd like to see it in the next stage. That it won't be a formal report, but it will be a briefing that I'm really happy to share.
Lovely. So I've got Councillor Dan Crawford, then Councillor Kate Crawford. Are there any other indications in the room? Okay, so we'll go Councillor Dan Crawford and then Kate Crawford. I'm just mindful that we've got Maggie Byrne from the Ealing Reclaim Social Care Action Group as well.
Thank you, Chair. So please cut me off when you've had enough, and I might come back because I have a number of questions. Firstly, about the language that's already been used in this discussion. Terms like warehousing are pejorative. They stigmatise disabled people and carers and individuals. And I say, as a disabled person, we should not be using those terms. We should never use those terms. I've said this before when I chaired this committee, and continually people who stigmatise disabled people and continue to use these terms, well, it's a reflection upon them and how they perceive these services. Customers, Mr. Stevens, I'd like you to search your recollection and remember how many times, as chair of this panel, I asked you and officers of this council and participants on this panel not to use the term customers, because disabled people aren't customers. They can't go and buy another service from another borough or from another institution. They are not customers, they are people. They are residents of Ealing, and I think we should respect them. And with the greatest of respect, I'll move on to my questions, which begin, and I'll just do these questions, Chair, and then you can take some other people, with the Michael Flanders Centre on page 46 of the document. It says, let's start here, the Michael Flanders Centre for Older People Who Have Dementia and the Cowgate Service for People with Learning Difficulties, Many Have Autism. Well, I have a problem with that sentence, because I didn't interrupt you, don't you dare interrupt me. When the Michael Flanders Service was formed and when the centre was built, it wasn't just for people with dementia. It was for people with a number of disabilities, conditions, and other things, right? So that sentence is inaccurate. It then says the Cowgate Service for People with Learning Disabilities, Many Have Autism. I don't understand what that means, so I'd be grateful for some clarity. In the section A of the Michael Flanders Centre, it says capacity 75 people each day. The Michael Flanders Centre in Acton can serve many more people than that. It may not at present. It then says on the fourth bullet point, many come on the green buses. The green buses, I believe, are the Ealing Community Transport buses. Given that Mr. O'Keefe, who's watching this briefing, set up Ealing Community Transport and was a member of this panel, I'd like us to refer to the buses by their names as Ealing Community Transport buses. Perhaps the most offensive part of this section is it says the building is located in the Acton Gardens regeneration site. Well, it is not. It has an address. It is not within the Acton Gardens regeneration site. It has an address. This is actually very important because it comes to the most pertinent point of this whole debate, which is, are these centres going to close? Are they going to be regenerated? Or are we actually going to have a holistic look at how we offer a service for the users? And I'll stop there, Chair, because you're nodding at me.
Thanks. And Councillor Crawford, I think I should just start by saying that in terms of the language in the conversation, it's really important, of course, that we're using accessible language that is right and proper. I haven't seen evidence in this conversation this evening that hasn't been the case, but I'm happy to talk to you about that further. I will come to Kerry and then I will come to Councillor Newstub.
So in terms of when I was using the term warehousing, I wasn't referring to warehousing as a positive service offer. I was using it as a wholly negative example of how services are provided. And I think the councillor is using my terminology inappropriately and pushing it back to me. And I don't appreciate that. I think in terms of the wording within the report, I think the point with regard to people with learning disabilities, we've missed a word out in terms of many who have autism, and that's a mistake on my part, to which I apologise to the board, to the committee. The 75 people a day limit at the Michael Flanders Centre is not based on the size of the centre, it's based on the budgets that are available and the staffing that's available for the service. And I apologise also to the committee in terms of the use of the terminology for green buses instead of the correct terminology of the Ealing Community Transport. But I fully stand by the language that I've used in this meeting this evening.
Councillor Crawford, did you want to come back?
Chair, I wasn't accusing anybody of anything. I was merely saying that both Councillor Newstub and Mr Stevens used the terms warehousing and customers. I understand that he has a different view as to what he was, that people have different views about the use of words. I say to anybody that we should speak of people positively, and this is a point that I have made repeatedly at this panel and in writing and when chairing the panel, and we must treat disabled people with the same respect that we treat anybody. I appreciate Mr Stevens was not intended.
So I think...
No, hang on,
So
I was speaking.
sorry.
I was speaking. And
I think you need to speak through the chair with respect.
Please,
thank you.
Absolutely, Chair, and you can cut me off, but this is an emotive subject, right? I'm a person who's used these services. I'm a person who may well continue to use these services, right, in my view. And it's about how we present and how we use words. And that's all I'm trying to say. People may well interpret words differently, but the disabled people who are watching this broadcast this evening take an inference from how they are described. And I am just giving that lived experience as a former chair of this panel and as someone who uses these services, that we need to reflect on some of the language that we use. I'll leave it there, Chair, because it's obviously emotive, and I don't mean to upset anybody, but I think it is important that we...
Thanks, Councillor Crawford. I am going to bring it to a close there. I think your comments on that particular area have been noted. We're at risk of overrunning massively, but I think most people sitting around the table would agree with your remarks. As I said earlier, I haven't seen evidence of inappropriate language this evening. I'm very happy to talk to you outside of the meeting about those issues. Councillor Kate Crawford, I'll come to you now.
Well, I'm just going to say that the term warehousing upset me as a carer and as a mother of someone with disability. So I just hope that we can learn from this, and, you know, whether we're just referring it to, you know, what someone else said or another report, please, let's not use, let's think of something better, because I actually got upset by hearing that. So my question, my interest is very much about, you know, as Councillor Crawford mentioned, that we've got dementia in residents visiting the Michael Flanders centres, and we have residents who are termed as being more profound attending Cowgate. I know Michael Flanders, I know the size and what it offers, and also possibly what it could offer, but I don't know Cowgate. And for someone who is, you know, has an interest in buildings and how they can be used, the fact that we have something like Michael Flanders with fabulous kitchens and the space, I hope we're considering de-specialising the centres, where if they're big enough, if they're actually big enough to hold different groups, different support for the more profound, or if someone has dementia, it's far better to have a mixed group that can have a lot of activities and support, rather than two very specialised centres. And so I'm just hoping that we're looking at what the outcome, from the surveys, the consultation, what people are saying, and whether these buildings, which are known probably quite well by local people,
Councillor Crawford,
can be used.
Can I just
rather
ask
than starting
for the question?
again. Absolutely.
Thank
finished.
you.
Yeah.
Kerry, over to you.
Thank you, Councillor Crawford. So the review we're doing is looking at the services. It's not looking specifically at the buildings. The plans that we're drawing up will be our absolute focus, and the byproduct in terms of how those buildings will be used in the future will be the services will be the focus of the reporting, and the byproduct will be how the buildings are used. If services are to be developed and placed elsewhere within the borough, then there'd be a different view in terms of how the buildings are used, and I can't comment on that at this point.
I thought.
Councillor Crawford. Oh, your microphone's not on. Thanks.
The report states somewhere that the council's looking into suitable alternative venues.
The report states that the focus is in 3 specific areas: to give people more choice and control, which is our absolute priority; to make the best use of council buildings, which is separate, secondary; and then the tertiary issues to get the best use of our budget. But our absolute priority is to provide choice and control, and I think I've set that out quite clearly in terms of how that impacts on the finances and the decisions made by the council.
Councillor Steed, and then I'll go to Maggie from Erskag. Thanks.
Just a very quick point. When my group had a separate briefing with you, Gary, you did specifically mention the 4 sites where which might be developed further. I think it might be helpful if that was shared with the panel this evening. And it raises another issue, which I don't think we're going to have time to go for now, is the whole issue about the, in inverted commas, no financial implications, which is mentioned within the report. And I'm just wondering clearly, or obviously perhaps, about the implications of those 4 sites which you've mentioned to us. There must presumably be some financial implications as to upgrading those 4 sites, but I'll leave it there.
Thank you, Councillor Steed. The 4 sites that you're referring to, the daycare sites, which are part of the PFI buildings. So we've got PFI contracts for 4 care homes across the borough, each of which has a purpose-built day centre attached to them. They're part of our planning, our discussions as options, but we've not finalised anything as yet. The additional costs associated with using the PFI buildings would be minimal, especially compared to the capital costs required to maintain the older and less and not specifically constructed day centre sites that we're using at Cowgate and Michael Flanders. That makes sense?
Yeah, no, yeah, yes, and yeah.
Can we use mics? But
sorry. Yeah, it makes sense, but I think that look into a bit more detail, which presumably when the report comes out in April at Cabinet, it will be in there.
So I am going to bring Maggie Byrne from Erskag in at this stage. There will be an opportunity to further scrutinise this area of work. Maggie, can I come to you?
Yes, thanks very much indeed, Chair, and also thanks for that discussion. A lot of the questions we were going to ask have been raised already and commented on. I suppose we just wanted to know about the options for improving the service and whether whether there will be actual consultation with users and that around the actual specific options.
Thanks, Maggie. No, that's helpful. Kerry, I'll come to you.
I had written down, thank you for your question, Roy. Sorry, Maggie. Thank you for your question, Maggie. Absolutely. So the engagement process will be ongoing with people who use services, the staff and the people who use services carers. This is the beginning of what is likely to be a fairly long process, making sure that we keep everybody very well informed and aware of what the proposals are. And again, as I said earlier, the importance of developing a service that reflects the needs of the communities we serve is absolutely key. So we need to keep everybody informed of what the development plans are.
Thanks for that question, Maggie. I'm happy to take final comments from panel members, but I would remind colleagues that we do need to move on. So Councillor Crawford, I'll come to you.
Thank you. Just to point out that 3 of my questions from earlier have not been answered. I'd like to speak about the diagram on page 51, and I'm going to do it in the words of my constituent Maisie, who's written to me, and forgive me, you're going to need to give me a moment to log in because Ealing Council's IT systems are interesting. At the best of times, Maisie has written to me, there is a diagram in this document on page 51 that says why is our dementia day service needed, the purpose, and then underneath, why is our disabilities day service needed, the purpose. I'm just going to show it to everybody who's in the room so that they know what I'm referring to. Maisie asks me what the picture underneath the second set line, the purpose, is supposed to illustrate. Does it illustrate that people who have dementia or disabilities don't know what they're doing, don't know what they're thinking, or, and she's quite cynical in the way that she phrases this, does it illustrate that Ealing Council has no idea what it wishes to do? She says this is a very offensive diagram and it shouldn't appear in an Ealing Council document discussing people with disabilities. May I just remind participants, these are not my words, they are the words of a constituent of North Acton about this diagram and its place within this document.
Thank you, Councillor Crawford. Councillor Newstab or Kerry?
I mean, so there is an organisation called Easy Read that specifically, I mean, Kerry, you might be better placed to, but that specifically ensures that language is accessible and also has images and ways of presenting information that is deemed to be accessible. That is precisely and exactly where these images and a lot of the text is taken from. And when we are consulting and engaging with people who may have various learning disabilities, it is the images and the ways of speaking that are called upon. That is by professionals in the space, not by people who seek to somehow assume that people can't or don't understand things. Kerry, you might be better placed to add more to that.
So absolutely, as Councillor Newstab says, the picture of the man with the question mark at the bottom of page 51 on the left-hand side is a easy read emoji, for want of a better term, which is used to support people with learning disabilities access documentation that we use as the council. It's best practice to use this formatting.
Thank you, Kerry. And
I believe it's developed by MenCap, but I couldn't be sure.
Thank you very much, both. So in terms of next steps in on this particular item, we will obviously, I think you will have seen from the room this evening that there's lots of interest in this area of work. We will ask for an update report to come back on the project to note progress moving forward. Now, Councillor Newstab, yes.
I mean, this is, we have to be more ambitious about what we offer those who draw on our services, who draw on care in our borough. You know, that is an absolute moral imperative, and it's an equalities issue, particularly around where we locate our services. And we will, I believe, collectively, we work well with input from those who use the services, draw on the services, their families, their carers, and all of us here who care deeply about this provision, we will get to a point where we're able to do exactly as I would know that we all want to do, which is treat people with individual needs, ambitions, hope for their lives, dignity, respect, independence, choice, and that is precisely what this project is about delivering.
Thank you, Councillor Newstub, and I'm sure the panel will have noted your comments. I'm afraid I am going to move on now because I'm afraid, Councillor Crawford, I'm afraid I am now moving on. Thank you. So Councillor Crawford, I'm happy to speak to you afterwards. I've been more than lenient in relation to
don't
this
believe, Chair,
item.
Chair, with the greatest
Councillor
respect, I'm going to let you move on, but I'll just say that this is insufficient for a decision of this magnitude in terms of pre-scrutiny that goes to the Cabinet next month.
Councillor Crawford, there is no decision that's being made this evening. There will be a follow-up report that comes to the panel. I do appreciate the strength of feeling. I have been more than lenient. It is now 5 to 9. We have another agenda item to cover, which is about the, I'm sorry, I don't think it is pathetic. So I will now move on to the CQC and LGA inspection reports and the updates on the Adult Services Work Plan. Councillor Newstub, could I come to you first and Kerry afterwards? Thank you.
Yeah, I mean, we wanted to bring this report. It also feels like a very long time ago that we had CQC come. And I know that many people in this room will have spoken to them, and thank you for everyone who did. It was a process that we ultimately felt hugely disappointed in. For those who haven't had an opportunity to read the report, we did receive a requires improvement assessment for our adult social care. That's obviously enormously disappointing. I'm going to slightly throw smoke in that CQC at the time and continues to be an organisation that has yet to settle in terms of its regulatory powers. However, we are an organisation that is very happy and we're very committed to improving, and where there are learnings to be made, we will make them. Just in terms of the wider context of why we're also presenting an LGA peer review is that in 2022, I think it was, early 23, there was an LGA peer review of our adult social care. Many of you would have been instrumental in that work as well, and I think perhaps Councillor Crawford was talking about that involvement earlier. That really set out the work that we needed to do and the journey we needed to go on. We felt we had met an awful lot of that, and it was a very positive driving force for the changes that were made within adult social care under Kerry. We subsequently asked them to come back in, which they did just before Christmas, to review our progress on both that review and reflections on the CQC report itself. And we found that to be a wholly positive experience, which you can see in the report. We would never say that we don't have anything to learn, and that's the sort of mindset that we go into the years ahead, having learned from that, and we welcome CQC back as soon as they are happy to return, because we believe we can significantly improve on that.
Kerry, anything to add?
Not hugely, Chair. I think Councillor Newstub's covered the levels of disappointment from colleagues across the service. We've got a large and very committed workforce in adult social care in Ealing, but also more widely in terms of the partners we work with within the Borough of Ealing. And I think we were all very disappointed in the outputs from the CQC inspection. We think there's a range of reasons for that in terms of the cycle that CQC are on, the difficulties they were facing organisationally, the fact that they were using out-of-date information, and included within the report is some updates in terms of service improvements, and the information was available at the time of the inspection. We're not perfect. organisationally, we never will be as a system, and it's really important that we keep challenging ourselves and holding ourselves to account, and we will take the learning from this report. And I think we said we'd bring something back in the autumn, Chair, in terms of our cycle of updated work plans, reporting to this committee. So we take it and we carry on. I'm very clear that all my staff are very committed. I'm very proud of what they do and how they support the communities we serve in the borough.
Thank you, Kerry. So I'll come to questions now. I've got Goulet and then Councillor Dan Crawford. Goulet. If you could just use your mic, Goulet. Thank you very much.
So I've got two questions. The first one, given the findings in both the CQC and LGA inspection reports, which highlighted concerns about the support available for unpaid carers, particularly in terms of timely assessments and ongoing support, what specific actions is the Council taking to address these issues? And the second question is, Ealing Council provides an online self-assessment form for carers, but there's no option to submit to anybody else except the social worker. I myself have been a carer for the last 10 years. I am not linked in or engaged with any social services, but still require support. Why isn't there a direct pathway for GPs to receive this self-assessment form and act on these assessments? And what steps is the Council taking to ensure that all carers, regardless of whether they have a social worker, can access timely support through healthcare channels? Thank you.
Thanks, Goulet. I think two important questions there. Kerry, I'll come to you. Thank you.
Thank you, Goulet. You're really earning your money tonight in terms of a new co-opted member. So really helpful questions. In terms of the response to the concerns based in both reports in terms of how we work with carers in Ealing. So we've got the refreshment of the carers strategy, which has been engaged through the carers group to review the service offer that we have for local people who are carers in the borough. And that's something we will continue to roll through and improve through the work that we're doing with the co-production board. The question about the online carers form, I'll need to go away and speak to some colleagues about that. Hadn't even considered how the carers form could be shared with general practice or other medical partners within the system. We'd need to check the data sharing requirements of that sort of thing, but I think that's a really helpful and important point, and I think it goes back to Councillor Conti's question, feels like an age ago now, with regard to how do we work within the community in terms of a multidisciplinary approach, but that's a really helpful point, and I'll take that back to the team in terms of how we gather the information, whether the information can be shared, and then how we do it in a community-focused approach across both the NHS and social care in terms of carers focus. But thank you.
Councillor Newster.
Yeah, I mean, Goulet, I mean, I would really welcome further focus. I mean, we have got the carer strategy, but I think that's just the beginning, you know, putting something down on paper, and we've discussed it with Kate as our carers champion. There's so much more that can be done, and there's so much more that people need, that we need to do to let people know what support there is. And I think, you know, that the sort of, and Maggie as well, if she's still there, she is still there, has been giving great feedback on just the sort of perspective of what it's like and how we can be better and how we can get out of the way of ourselves in the way in which we can support people better. And that is everything from sort of stress testing, and publicising the fact that there are parking concessions for carers, to a whole range of different things that we can offer to support carers, whether it's specifically in their caring role, but more widely to take some of the pressure off the impacts that being a carer can have, and also to be kind of a bit more joyous about it. You know, I mean, like it's caring is often presented as being a very sort of doom and gloom kind of thing, and actually I think with a bit more sort of leadership and cohesion and joined up thinking across the borough, we can actually amplify what we can do and celebrate a bit more effectively as well. I'd love to work with you on that.
Thanks very much. Goulet, any follow-ups?
I would take up on your offer on working together with you, and I do want to see a big improvement. As being a carer myself, I haven't received that support I should have received in the last 10 years. Thank you.
Thanks, Gule. Councillor Dan Crawford, over to you. Thank you.
Chair. So I think my frustration about the previous item and the outcomes of these two items are interlinked. I don't disagree with anything Councillor Newstub or Mr Stevens said about the Care Quality Commission and how long it has taken for the Care Quality Commission to do an inspection. Colleagues like Councillor Steve, Councillor Conti, people who've been on this committee will remember how long it took and how long we've been asking for this sort of assessment. But I associate myself entirely with what Goulet has just said in respect of carers, and I don't wish to, and I certainly will not in this room, dismiss carers, never. But it goes wider than carers. The CQC has said that we require improvement. That's actually, you know, that's very serious, and I know that the gravity of that is not lost on anybody in this room. The question is, why have we not been tackling some of these issues already? Why is there limited information in so many areas? And what are we trying to do to rectify some of these issues? And I'll finish with just one additional question, which is that we've heard a lot this evening about how we're going to shape services and offer choice. And the idea is to model the seven town approach to provide choice and access to services across the 7 towns of Ealing. Well, many of the 7 towns of Ealing are not served by the type of services that they need to be, and demand is only going to grow. I praise all of our social workers, including Adonika Tilleray and many of the officers who I've worked with over a number of years to deliver change here. But the question really is, if we require improvement, what does that improvement look like, not just in 6 months' time, but from next week? And what confidence can the people sitting here this evening give us that it's going to be better? All I would say in respect of the discussion about carers, it's a terrific carer strategy. I've yet to see it. It went to the Health and Wellbeing Board. It didn't even go to the council's own carers champion. If that is not a damning indictment, if that is, excuse me, I didn't interrupt you. If that is not a damning indictment, I didn't interrupt you. Sorry, did you just say I lied?
I'm sorry, I've had a meeting with the carers champion
excuse me.
to go through the carers. I will not be called a liar.
I didn't call you a liar. You said, excuse me. I did not interrupt Councillor Newstub, and I was speaking.
Through the chair, please.
Yeah, and I was speaking through the chair.
So, have you finished your?
No, I was speaking and I was interrupted.
That's fine. I will come to Councillor Newstub in due course, but I would like you to finish your questions, please.
Thank you. My point, and I'll re-emphasise it, is yes, Councillor Newstub, you had a meeting with Councillor Kate Crawford after the carer strategy went to the Health and Wellbeing Board, after it was considered by the Health and Wellbeing Board. That is a matter of fact, right? That is the wrong way round, and the co-chair of the carers co-production board will agree with me that if we're going to put carers front and centre of our carer strategy, it'd be a good idea to ask them first, not after we've started writing it. That was my point. If you think I'm lying about it or I've misled this committee, then please say so and we'll deal with it.
Councillor Crawford. So I'll come to Kerry and then Councillor Newstub afterwards. Kerry, specifically on the actions that the team will be taking in light of the RI judgment.
So the actions will be set out. They've already got a list of actions that are included in the report, and we'll be bringing further updates to this committee in the autumn in terms of the programme of work. Very targeted and very clearly focused on the areas of weaknesses that are highlighted within the CQC report. But just like to remind members of the committee that we've set out on page, just trying to find it now, 56 and 57 in terms of where there's improvements in services. So access to information has seen significant improvements. during the period of the inspection. This wasn't included within the inspection report. So there's two bits. So the work programme will bring back to the committee in the autumn, Chair, but in terms of the access to information point that the councillor raised, there have been some significant improvements for carers and for people who use services.
Thank you. Councillor, oh sorry Kerry, did you want to say something else?
Just one other point with regard to the carer strategy, the carers co-production group have been actively involved in the development of the carer strategy.
Lovely. Councillor Newstub, did you want to say anything?
I don't really have anything to add other than that I believe on our next item, we've got one final item that looks at that planning and transformation plans precisely in order to kind of meet some of those mitigating elements. You know, an awful lot of that work is in place and continues to be in place already to respond to the issues raised.
Thank you. So I've got Councillor Dinser and then Alan, and then I've got Councillor Conti. Are there any other indications? Councillor Kate Crawford after that. So Councillor Dinser, thank you.
Thank you, Chair. I'm mindful of the time, so I'll be brief. Appendix 2, you know, summary of people experience headed under that headline. You know, people found it difficult to get in touch with the local authority, and a lot of people were concerned about over-reliance on online. And it will be very true of people living in Southall. They will struggle to get in touch with the council online. What are we doing to make sure these people do not lose out on the support they are entitled to? Especially, you know, I've spoken to a number of people who time after time they say they're not very good on IT and they struggle not only for this service but very many other services. So what actions are we taking to make sure that happens?
Thank you, Councillor Dinser. Kerry.
Thank you, Councillor Dinser, and I think it's a really important point that often the drive within many services, not just within local government, is to move people online in terms of how they make queries and can contact service providers. We're very conscious within adult social care and the other social services departments within the council that channel shifting or moving people online isn't the only option that's available. We're working closely with the wider council to promote the Connected Communities programme of work so that we show up in local communities, whether they be in Southall, Greenford, Northolt or any of the other areas of the borough that we serve, so that we're more accessible. We've got a pilot project at the moment on the Havelock estate where we've got council officers being available through a shop front to take queries, and I think that's something we really need to build upon, because those who can use the internet to access services will find it more straightforward and easier to access, support that route. However, we need to make sure that we're also showing up in place for individuals who can't use the internet, and I think it's particularly relevant in the diversity of the community we serve in Ealing.
Just briefly, please, Councillor Newstub.
Yeah, I just to echo that, I think it is really crucial, and it's not only about digital exclusion, it's about its language and accessibility. We have 60 languages in the Borough of Ealing. We need to be very, very mindful that we're not excluding people. We do have the community hubs within the libraries that will often be supporting people to access precisely these kinds of services. But I think I completely agree. It's volunteering and advice services I do. It's something that comes up over and over again, is people feeling very unconfident in the digital space. And I think we need to be absolutely front and centre, mindful of that. It's a really important point. Thank you for raising it.
Thank you, Alan.
Thank you, Chair. Just to take the discussion on communications and online a little bit further, there are some people that are housebound that cannot use electronic communications. They're finding actually that when they write letters or phone calls, the phone is never answered, or if it is answered, can we ring back at a certain time? They never bother ringing back. And as for letters, there are occasions when letters don't even appear to have been answered 3 months later. And I think that is an issue. Yes, people could use electronic communications, and as has already been pointed out, not everybody can. And I think it's important. Yes, you've said about meeting people in the community sort of thing, but there are people who are housebound that we've got to do something about. Thank you.
Thanks, Alan. Kerry?
Thank you for your points, Mr. Cook. I think they're really important. We're working all the time to try and improve how we support people access services and information and advice within adult social care. We're currently going through a process in terms of looking at our workflows and our front doors so that we can be more responsive to telephones. We've recently reduced backlog of some of our waiting lists quite significantly, which has been a response to the CQC inspection and the LGA peer challenge as well. Individual cases where there have been system failures, I know you do raise these with me. I know that there are issues within my service as well as other services within the council, but I will pick up those individual issues and get a response to you at the earliest opportunity. But the point about housebound individuals is a really important one, because if people can't show up in community because they're housebound, then that's a real challenge. And I think again this goes back to earlier points and discussions in this meeting about how we share best practice and information within the community. So district nurses may be visiting somebody, doctors may be visiting somebody, and therefore ensuring that we've all got access to the same information and support will enable people to access better information through those routes.
So I've got Councillor Conti now, and then Councillor Kate Crawford after that, and Kate will be our last speaker.
Thank you. Two questions. One was on page, not numbered, I'm not sure. It says where safeguard inquiries were not always allocated promptly, and there was a waiting list. I was wondering whether that's been addressed and whether that's now there's sort of a plan in place to sort of make sure that those are being acted on more quickly. And my second point was just on Appendix 3, which was the delivery plan summary. One of the amber ones is on direct payments, and I think last year that was also amber. I was just wondering, and I think it says that that it's still circa the same percentage number of people. Why is that not moving forward? Why are we not making progress in that area?
Kerry.
Thank you, Chair. Thank you, Councillor Conti. We took exception to the statements made by CQC with regard to the waiting times for safeguarding. There are some specific concerns and technical issues that we don't believe that they were following or understanding, and we put that challenge. We've shared the report, obviously, with the independent chair, Robert McCulloch-Gray, and he's provided assurance and scrutiny to our processes. What's really important is in terms of safeguarding referral that we can triage them and get them into an inquiry stage if there's a level of concern that supports that. But I've been very clear that we needed to get the independent view of the safeguarding chair to give us oversight of that, to make sure that I wasn't just responding in a defensive manner to the CQC inspection. So I'm satisfied that he's satisfied. The direct payments progress is something we discussed before here. You may recall that in end of 2023, 2024, we were going through a programme of consultation and engagement with local people in terms of developing a direct payments model that reflects their needs. We're now in the implementation phase. We've had additional investment from the wider council to support us increase the uptake of direct payments in Ealing. We are an outlier in London in terms of the proportion of people in receipt of direct payments, and this is now one of our main missions in terms to improve the uptake, because it makes a huge difference to people's lives. Why there's not been progress in the past, there's a lot of different views and thoughts about this. The prevailing view is that because we have such a dynamic, flexible and varied market in terms of domiciliary care in Ealing, we've got the we only commission from good and outstanding. we've got over 100 providers in the market in Ealing, that individuals can meet their needs through a standard traditional care offer rather than needing to go through a direct payment. But we're challenging ourselves a lot harder on this, because we know that if we can support people onto direct payments, they get greater flexibility. More of Ealing Council's money stays in the borough rather than going to national care organisations, and it improves people's lives. So we're really taking that forward. But I think it's a valid question. We will be bringing back reports to this committee in the future, which will show progress and updates in terms of performance.
Thank you, Kerry. Councillor Newstep.
I cannot stress enough how much of a focus I am making this in terms of the work programme of the teams. I believe there is a really strong moral imperative around people having that choice and control over their lives, and we have to put the operational heft into place to make that happen. And we're running. It's not something we can come back to with excuses in a year. It is. We know that it improves dramatically people's lives and people's independence and the choice of people to spend their money and access care and whatever they choose, rather than it being defined by a limited range of options that we might consider the best thing for people. So I please take it as noted that it's a very strong part of my focus and pressure on Kerry and the team.
Councillor Kate Crawford.
Okay, firstly, I think I'd like to actually pay tribute to Councillor Newstep, because following the many years of being the carers champion, and probably 38 years being a carer, she actually was the first cabinet member, the first chair of the and I include chair of health committees, other than Dan.
Careful.
No, it's been a sadness to me that she was the first person to invite me to contribute my understanding of the carer's role and how it affects various policies and what and work in progress. We did both express our concerns and disappointment that we were not invited. Neither of us was. We were quite forgotten. We were not invited to contribute to the drawing up of the carer strategy. And I hope that we can make some sort of recommendation at the end of this committee about the role of the carers champion. I've shared that role with brilliant councillors, and it's something that needs to be done. And what I really feel, particularly with what you've said, that you are a working carer, it is addressing the how the situation where carers are put into feeling so isolated and lonely. You work, but I bet you don't have the time to go out. You get home, and the same applies to young carers as well. You get home, you've got things to do. It's always on your mind. So I would like to see, and we did discuss it in a very good discussion, that more outreach work. It is not only wanted, but if the council are actually supporting and funding voluntary groups, voluntary agencies, the carers groups, we have to see them doing outreach work in our 7 towns. It's really important. Carers, the attendance in these groups are very low, including our day centres, really low. And you're quite right, Councillor, it needs to be more fun, and carers being given the opportunity to follow interests, find other carers to follow interests. How we do this, but I think this is a possible future perhaps next year, a discussion where carers actually say really, you know, what is wanted, and we invite the agencies, you know, the voluntary sector to come and have a pretty good discussion. How do you feel about that? Thank you.
Sounds excellent. Kerry, Councillor Newstead, do you want to say anything?
Thanks.
Lovely. In which case, I think I'm just going to move to Maggie, who has a couple of questions, and then we'll wrap that item up. We will come to recommendations beforehand, though. Maggie.
Yes, it was just really a lot of council energy went into both the CQC and the LGA reports, and we just wondered if did the inspectors ever meet or communicate with each other between CQC and the LGA, because they came to such contradictory or apparently contradictory conclusions. That's all.
Kerry, I think we know the answer, but do you want to confirm?
The formal response is, I'm afraid I have no idea whether CQC and the LGA communicate, but I doubt it.
Thank you very much, Kerry, and thank you, Maggie, as always, to you and ERSCAG for your interest in your questions. So, in terms of recommendations, Kerry, I think you were going to give consideration to sharing the carers form and how we might do that with other services. And Councillor Crawford, Kate Crawford, you were particularly keen for the Carers Champion to be engaged in ongoing work, and also suggested a specific item for consideration as part of next year's work programme. Are we happy with those recommendations? Lovely. Well, all that remains for me to say is I appreciate at times that the meeting has been a bit fiery and heated tonight. I would remind colleagues that you know, we can disagree without being disagreeable, and that's a really important facet of scrutiny moving forward. Our next meeting is on the 1st of May, and I wish you all a very good evening. Thank you.
Thank you, Chair.